All right, going over the wrist recovery stuff. So I got all these on here. I got them 1 through 6. So we're gonna go through everything, and then we got the different kinds of tips. So we got round foam, then we got plastic flat, and then we got bullet. So it's the inside of the hand. So going down the center, and then just to the side, so the upper side of it. So right here. Again, we can sweep through this upper half of the forearm and find where it's most tender, and then we're gonna hold it. Then there's a little bit of finesse, so it's on there, but I can also turn it and it's gonna direct more down toward my hand. If I go up, it's gonna direct more up toward the elbow, but it's really not gonna go past that joint if it's not, if it's really not connected to other tissues. So a little bit longer. All right, we're good there. So next one is going to be on the outside. So right over the top. So if I go and do my handshake, right, it's going to be right here. Okay. So again, find a relaxing position. And we're going to do it for 30 seconds. Should feel it radiate through all the way down here, a little bit in the palm. You're going to feel it up above the elbow for this one. You can also go up and down and flex. Alright, next one. This is, we got to change to the bullet tip. And it's right next to the thumb here. So first, right in here, so if you're putting your hand down, you should be able to feel it without it turned down. Without it turned down, put your hand flat right here, okay? So there is the muscle. You're not trying to hit the bone, okay? So nice and gentle. And then see how I'm in between, right? And then I'm going to slightly go in. And you should feel it through the palm. And obviously the pointer finger. See right here, okay? See right here. Keep that webbing open, so keep your thumb open. You're gonna feel it through the wrist, through the palm. And make sure you keep that thumb open, that meaty part open. Okay? See, if I come up, you can see it bouncing, right? I want to stay in there. So right here, right in between, feel the palm. You can slightly relax your hand, it'll help it vibrate, but just keep your thumb as the flexed one out, okay? A little bit more. Again, you can redirect it. Oh, that actually feels super good. So let me show you from here. Let me show you from here. So my palm is down, and it's directly perpendicular to my hand, okay? Alright, I'll show you this way. So, see how I'm 45 on the, if my hand was flat, I'm 45 on. Okay, next one up. So, inside of the elbow with a foam or flat tip. Again, I like to go use the flat. Okay. So right through here, here's the bony process. Right here, bony process. So past the elbow, and it's about 2 fingers over. So right here, just like so. So again, here's my elbow. radiate through the forearm. Again, you can also flex and see where the tension is. You can do circles. It does, yeah, it tenses up a little bit. But we're trying to break up this tension in the wrist so they don't hurt, okay? And good. Alright, we got that one. Now we're going bicep. This one I do like to use a foam tip. So foam tip on the biceps. Bicep. So on the top, on the front here, so you got the whole surface area right here. So here to here, right? We want to get right there and feel it. Now, you do have an artery in that bicep, but it's like right there. So make sure you're just not directly on it. And the more inside, the more closer to that is. That would really make your bicep tinkle for a while. Twinge for a while. And then you want to get the top. Again, stay away from the artery. The top one is going to activate the shoulder quite a bit more. There's fibers that your bicep attach up at the shoulder. So you should feel it in the front of the shoulder with this one. Alright. And then our last one. It's a little bit tougher. So where your armpit is. I gotta turn it off for a sec. Where the armpit is. So what you want to do is come up where your bicep is, and underneath it right here, this is where we want to get. You should be able to hold. I'm trying to see if that was Zoe. You should feel it flex and it not move. So underneath, flex. And you should still feel it. So I have to slide in a little. There we go. So you are going to feel this a little bit in the pec, but it shouldn't go up. And then I can also point down a little bit to make it radiate toward the bottom. If you get like a ding 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 electric shock, it's because you're right on the artery right there. So I'm above that artery, and I'm trying to slightly lift up that bicep. Okay. And obviously, if it's comfortable, relax down. Alright. If you want to put a separate timer for everything for the other arm, and then in the future too, go ahead and do that. Take care.